Good afternoon. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, Stephen McNeil, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Chrissy, and good afternoon, everyone. I'll ask Dr. Strang to give us an update on COVID-19 in Nova Scotia.
Thank you, Premier, and good afternoon, everybody. Today I'm reporting one new case of COVID-19, which brings the total number of confirmed cases in Nova Scotia to 1,053, and that this new case, like previously many of our cases, is associated with the ongoing Northwood outbreak. That is a resident at Northwood. And so with this addition at Northwood, we have 12 residents and 4 staff with active cases of COVID-19 in this facility. This is the one long-term care home that still has active cases of COVID-19. I just want to take a moment to again thank all the staff at Northwood and people from across the health system who have come to work in Northwood to continue to provide care and support as they work to keep residents safe and ongoing work to control the spread of this virus. Yesterday, the QE2 labs processed 533 tests, and we currently have 7 individuals in hospital, 3 of those in the ICU. 975 people now have recovered from COVID-19. And once again, I know that people watch the numbers very closely. As I've said before, we continue to update our case information to make sure it's accurate. And as part of this ongoing process, the number of recovered cases has been reduced by 1 from 976 to 975, just if people have questions about that. We have now 39,441 people who have been tested for COVID-19 in Nova Scotia and have received negative results. Back to you, Premier.
Thank you, Dr. Strang, and I'm excited to talk to you about next steps. These steps are only made possible because of your hard work, and I want to thank all Nova Scotians for continuing to follow the advice of public health. Today, I'm announcing that parts of our economy are ready to restart. Effective June 5th, most businesses that were required to close under the public health order can reopen. Restaurants for dine-in as well as takeout and delivery, bars, wineries, distilleries, and craft beer tap rooms, hair salons, barbershops, spas, nail salons, and tattoo parlors, gyms and yoga studios. Some health providers can also reopen on June 5th, dentistry and other self-regulated health professions, including optometry, chiropractors, physiotherapists. Unregulated health professionals like massage therapists, podiatry, and naturopath have also been given the green light for June 5th, as well as veterinarians. We believe that we have found a balance between public safety and restarting our economy. We are still moving slowly, but this is a good first step. We've considered feedback gathered through the consultation with businesses and associations. Dr. Strang and his team have been working to help them understand the protocols that they must follow as they reopen. I have every confidence that you can do this, and I have confidence that Nova Scotians will support you. Let's be clear, we will be monitoring the restart very closely from a public health point of view, and we will continue testing so that if there are any signs of the problem, we will be on it. We are still working, though, with our child care sector on a plan to reopen safely. We had hoped that this would be June 8th, but now it looks more like June 15th. We will share the official reopening date once the plan is fully approved. Our primary focus, though, will always be on the safety of our children, and we are not going to rush it. Now, of course, every business, every sector that is about to reopen must also follow public health protocols. Isn't that right, Dr. Strang?
Correct, Premier, and thank you. This is good news, and I agree that finding a good balance between continuing to control COVID and the importantly reopening the economy in our society. And like you, I want to thank Nova Scotians for following the public health rules and the advice which has helped us to get through wave one, minimizing the impact and be in a place now where we have a very flat curve. All Nova Scotians have risen to this unprecedented challenge, and it's because of everybody's effort that we're able to be here today. Allowing businesses to reopen with modifications is an important way to help create our new normal as we continue to fight the virus that causes COVID-19. As the Premier said, businesses that have been required to close under the public health order can start opening as of June the 5th. They must all follow plans that ensure public health protocols are being met. We're working with those businesses to make details of their protocols available for the public to see. Key protocols are keeping the distance rule of 2 meters or 6 feet wherever possible, and staying within the numbers of limits for the number of people that can gather. These rules, important rules about numbers and distancing, are critical to controlling COVID-19 and are here to stay for a significant lengths of time. Businesses, workplaces, and other organizations need to find a way to respect the physical distance rule. If a business is too small to ensure the 2 meters distance between customers or clients, then the gathering limit of which is now 5 applies. All businesses, workplaces, and other organizations also need to increase cleaning, especially high-touch surfaces and washrooms, support increased hand washing, encourage mask use when appropriate, and reminding and supporting people to stay home if they're unwell. Every business is different, and there are many ways to meet these protocols. The sectors that I have met with have all had lots of really good questions and their own observations, and we've had very productive discussions about how they can develop and implement reopening plans that make sense for their business or their service they provide or the presence they have in the community. I've been impressed with the comprehensive plans that I've received so far and the thinking that's gone into those plans. What that shows me that these sectors are taking the health of both their staff and the health of Nova Scotians very seriously. And it gives me confidence that we can reopen while mitigating the risks of COVID-19. We now have approved plans for several sectors. For example, I've approved plans for restaurants and cosmetology, and there are 2 sectors that have a great deal of complexity, and as I said, a lot of thought has gone into how they will operate safely. Many others have submitted plans that are in the process of being reviewed right now, and still others are developing the plans with support from Occupational Health and Safety and Public Health. Businesses that were not required to close under the public health order also need to develop plans to reopen safely and meet public health requirements. This will help them operate safely and help them demonstrate to their employees and customers their commitment to safety. For any business or organization that needs help developing a plan, there is now information on the website that was launched yesterday, novascotia.ca/reopening Nova Scotia. All of the businesses are taking responsibility to ensure the public safety. At the same time, I need to remind that individual Nova Scotians, we also need to do our part. We also need to continue practicing the personal protective measures. We have a role in making sure that we are maintaining social distances outside of our household or our household bubbles, that we are taking the responsibility to wash our hands frequently or use hand sanitizer if there's no soap or water available. Practicing good cough etiquette, coughing or sneezing into the sleeve. And I know yesterday I coughed and I didn't, and that's my apologies. I make mistakes. It's important that people avoid touching their face, limiting non-essential travel. How do we play a role in making sure that the high-touch services, whether it's in our own personal workspace at work or at our homes, making sure we're cleaning those? And we've got recommendations about we encourage Nova Scotians to consider wearing a mask, a non-medical mask, when they may be in situations in the public when they be around other people and can't maintain the social distance. So all of us, along with businesses, all of us have the responsibility and the opportunity to practice these, and it's continuing this collective effort which will allow us to reopen safely. Our new normal does mean modifications for all of us in how we live, work, and play. This requires everyone's patience and thinking and working with a focus on our collective well-being. Businesses and organizations are modifying the way that they operate, and we ask all Nova Scotians to understand and respect the new normal and also follow public health, or continue to follow public health direction. And as I've said before, as we continue to do throughout this, and we continue into this new normal, I ask everybody to act with care for each other, with a sense of community and our collective well-being, and using common sense of how we interpret and apply all these rules.
Thank you very much, Dr. Strang. We understand this has been difficult, and businesses are hurting, and reopening is challenging. Our government wants to offer some help. Today, we are announcing a $25 million small business reopening support grant. This fund will provide eligible small businesses, not-for-profit, charities, and social enterprises with a grant of up to $5,000. Many of you have to operate under entirely new conditions and maybe even change your business model. So along with the grant, we are offering a voucher worth $1,500 to access consulting services to offer you advice. This program is for those ordered to close under the public health order, along with small independent retailers, independent gas retailers, and dental clinics. If you receive the Small Business Impact Grant we announced in April, you do not need to apply. We will contact you directly. For everyone else, applications online June 1st. As well as the private sector gets ready to open, we understand as a government, we also have a role to play in getting people back to work. Today, I am pleased to announce on behalf of our government an infrastructure investment of $230 million. This money will go towards more than 200 shovel-ready projects, including additional paving on 100 series highways, expansion of our gravel road program, replacement of bridges across our province, green energy projects, school repairs, waterfronts, small option homes, and provincial museum upgrades. These projects will support small and medium-sized construction companies across our province who will hire Nova Scotians to do that work. This investment will create some 2,000 jobs in this fiscal year. Tenders are being issued immediately. We'll be happy to take any questions you may have.
Just a reminder, one question, one follow-up in the amount of time that we have today. First question will go to Global's Alicia Draus.
Thank you. My first question is just as we start to talk about stores and businesses reopening, a lot of people are just wondering, as some places are allowed to have 20 plus people inside a store, they're wondering why we still can't have social gatherings of more than 5 people, and when those rules might change and when Nova Scotians might learn more about that plan.
So we have to understand that, we look at the businesses and the retail environment. There are different dynamics. It's not just the number of people that get together, but the type of activity that they're doing and the settings. And so social settings have very different dynamics. And this is an incremental step. We're opening up a lot of things on the business side. We'll be talking in the very near future about how we continue to look at the number of people that can gather and how they can gather, but we need to understand that settings that bring lots of people together, especially in social kind of environments, carry their own unique risk, and we have to be very careful in that area.
Alicia, do you have a follow-up?
I do. There's a report out of Ontario where the military has been raising concerns about COVID-19 patients who are sharing rooms with those who are uninfected. And I know that this is something that happened at Northwood. So I'm wondering if you kind of stand by what happened at Northwood, allowing them to share rooms, and if this is something that might be addressed should we have a second wave.
So I know Northwood was well aware of they were separating people as much as they were able to within their kind of infrastructure, and as people removed, people who had recovered removed into off-site into another temporary facility, and there were other changes. They were able to separate people even more. So I think they did what they were able to do and what was appropriate given the infrastructure that they had. We have to acknowledge that also that many of the infection control things were in place, even though people were living in shared rooms, and there were infection control steps in place.
Next question will go to CTV's Natasha Pace.
Thank you. Just following up to Alicia's question and the report out of Ontario, I'm wondering if that makes either the Premier or Dr. Strang feel the need that there should be an inquiry into what happened at Northwood.
So first of all, let me just say thank you to all the long-term care facilities across our province. We have over 130 long-term care facilities, done a tremendous job of ensuring that COVID-19, if it came into the facility, was isolated, treated. What's happened here at Northwood, obviously, as we said, coming in, asymptomatic people were bringing it in unknowingly. When the virus get into the facility, it began to spread through the facility. We'll have a review of that with all of our partners, continue to look at lessons learned. One of the previous question about people living in double rooms is something that as a Department of Health we've looked at across the sector, particularly as we've been redeveloping footprints, whether it's a rebuild or a redesign, but we'll enter into conversations with Northwood and quite frankly those families who had experience in Northwood, all of whom by and large have come up with a positive impression of the care that their loved one was receiving. But we will, as I believe will happen across the country, there will be a review particularly of those larger facilities that have a number of residents in one spot.
Natasha, do you have a follow-up?
I do. So I just wanted to be clear that a review would obviously be different than a public inquiry, and there are still growing calls for a public inquiry. So at this point in time, there's no plans for that, correct?
We're still working to ensure that we deal with the issue at Northwood, continue to make sure that those who call Northwood home, who are active, get treated, and those that have been taken out of the home who are looking to go home, make sure that we do that in a safe manner, and we'll work with all of our partners to see what the appropriate mechanism is and what the changing protocols will be as we go forward.
Next question will go to Keith Doucette with Canadian Press.
Good afternoon, Premier. I was just wondering about the two big announcements for infrastructure. Whether is that new money? I'm not quite clear on that. And if it's not, where did you find the funds to be able to do those two programs?
So there's two. Number one, the grant. Are you referring to the grant program?
Yeah, one's the grant program for business. The other one's the $230 million for infrastructure.
Okay, so the grant program is not new money. It's money that we had set aside at Dalhousie. The two previous programs that we have, there was money left over in those, as well as you know, we had an additional $5 million. So we combined the money that we had set aside into this new fund to help people reopen and restart, and it's a grant program. The reason that there was funding left from the previous two programs, the federal government got out quite frankly quickly with the funding that they required to support individuals who either were self-employed or didn't have enough hours for EI, who we thought would use up about 20 million of that. So there was money left over in both of those earlier programs. And the $230 million is a capital investment that the province will make. And it's new funding. What we do, as you know, have a 5-year capital plan in Nova Scotia. These projects that we would pull up will be ones that would have been on that 5-year plan in out years. And it is really to try to make sure that we spread economic opportunity across the province for infrastructure that government needs, at the same time making investments in infrastructure that will allow us to build on that infrastructure for next year. For example, some of our museums will be making strategic investments in some of those for the tourism season next year to attract people. Our waterfront investments will be very similar, either removing some infrastructure or physical barriers that are there, or adding to and improving our waterfronts so that when we hit the tourism season next year, we will be able to build off of that investment by Nova Scotians.
Keith, do you have a follow-up?
Yes, for Dr. Strang. You briefly mentioned smaller businesses and smaller restaurants in terms of capacity and what you may require of them. I'm wondering about larger businesses, larger restaurants, and whether there's going to be any set number in terms of capacity? I mean, obviously they're going to be able to accommodate more people if they adhere to the rules for distancing. But are there any numbers there, like 50% of capacity, 60% of capacity, and how would you check that?
So this first step in the opening, and then it was in the proposal, and we support that proposal, is that restaurants would open to a maximum of their 50% capacity, knowing that they always have to limit their numbers so they can maintain that a distance of 6 feet or more between tables, and if they can do that, if they have enough space, they can get up to 50% of their capacity. We've also put a limit, that they can have the number of people that are allowed to gather for a social gathering, which today is 5. That is that when they open, they'll have to respect whatever the number is for that group number on June 5th. That's the maximum number of people in a party that could come and sit at one table.
Next question will go to Mike Gorman with CBC.
Thank you. Premier, sorry, I need a little more clarity on the infrastructure program. I'm not clear on whether the tenders that you're announcing today, is this part of the $1 billion capital plan that was announced earlier this year, or are you doing this on top of that $1 billion, which I guess would now effectively make the capital plan $1.2 billion?
Yeah, so it is, no, it is, so the capital plan, this announcement would be on top of our capital plan that we announced, the Minister of Finance announced, and it is projects that were on the 5-year capital plan. Some of it is highways, and as I said earlier, some of it is actual infrastructure, museums, some of our museums invest in, hopefully to bring tourism, same with our waterfronts, those kinds of investments. And then we've been able to and will have to repair some of government infrastructure, school roofs, some investments in healthcare that were not part of the larger investment that we've made.
Mike, do you have a follow-up?
Yeah, about 8, but I guess I'm only going to get one. Dr. Strang, can you talk to me, please, about, obviously you've been meeting with all of these associations and working on them with their plans, and at some point you said to them, you're good to go, and to the point where the Premier can announce the date that he has today. Perhaps I'd like to hear from both of you on this, but how confident are you that this information has been shared with people who work within all these industries to give them sufficient time to get adequate PPE, to make the necessary alterations they need in their shops so that they can actually open on June 5th? And do you have any concerns, Premier, that these restrictions in place, which obviously have to be there, may be such that they limit the ability for these businesses to actually turn any profit, even though they're now allowed to reopen?
So we've been working with the association. So I'll use the restaurants as an example with a Restaurant Association of Nova Scotia and Restaurants Canada, the Atlantic Division. They are the ones that had brought forward a well-developed proposal, and they had been working with all their members. So it's not new to them, and we've been going back and forth and making some recommendations on some changes in some areas. And today we were able to give them a formal approval, knowing around today's announcement. But it's not that but it's no surprise that the contents of what their proposal was. So it's really at the end of the day that how those associations have been communicating with their members and informing their members about starting to prepare, and they've had lots of time to do that. So we continue to work with it in that sector by sector approach, and we have been giving guidance, but ultimately each of the sectors have need to work with their members to work out the details. But much of what we've been saying, it should not come as a surprise to anybody about how they have to accommodate certain public health requirements as they start to develop detailed opening plans.
And to your question, Mike, there's no question, businesses are opening under different protocols. This will impact them, but they've been very clear, and their associations have been very clear. They're ready to open. They're prepared to follow public health protocols and do everything they can to be innovative and creative to ensure that they can weather this, keep their employees employed at the same time as we work towards ensuring that we don't get another spike with COVID, and we work towards ensuring that we can keep COVID. How do we live with COVID? And what are the changes that we can make at a future date that begins to help them continue to make a profit?
Next question will go to Lindsay Armstrong with All Nova Scotia.
Thank you. Premier, the Prime Minister said he's consulting with the provinces on mandatory sick days. How do you feel about the proposal, and how far along are those discussions?
Well, I've been very clear that that's a collective bargaining process. Can have it at the bargaining table. As you know, many people here in our province already have sick days in the public sector. What I have said, and what I'll continue to say, that I believe the national government can, through its unemployment insurance program, ensure that if someone needs to be tested for COVID, can give them that test period, whether it's 3 or 4 days required to go get the test and wait for the results to come back, that the federal government can do that through its insurance program. And that would be a good first step as both private and public entities negotiated the sick benefit throughout the collective bargaining process.
Lindsay, do you have a follow-up?
Yes, thank you. For Dr. Strang, you've said that some businesses listed for June reopening haven't yet submitted plans. Are those businesses without plans not allowed to open on June 5th? And which sectors haven't yet submitted proposals that have been approved?
So we've got a number of proposals that just in the last 24 hours have been coming in from a number of the regulated health professions. We've got one that's coming in that I haven't had a chance to look at yet today from the body art folks. So they continue to come in, but yeah, as we're redrafting the order, there is a requirement that all the businesses that have been closed down, that there has to be a plan in place that is approved before they can actually reopen. So we're working with them, very urgently. I know that a lot of people, my colleagues in government, have been working very long hours this week and expect to work long hours the next few days, supporting and moving our proposals through to get them approved. At the end of the day, there are some sectors that haven't had proposals in yet. It's their obligation to do the work to get us the proposals. We'll turn those around as quickly as we can once we get them.
Next question will go to Olivier Lefebvre with Radio Canada.
Thank you. My question is for the Premier, Stephen McNeil. Let me find it here. Sorry. I'm wondering how the province could help more small businesses like restaurants were struggling to pay their rent, but because their landlord refused to apply the Canada Emergency Commercial Rent Assistance, so they can benefit of the 75% relief and still have to pay 100% of their rent.
So first of all, as you know, that program just opened up 2 days ago for Nova Scotia. We're looking at that, monitoring it, about who has registered, if there are issues associated with it, why they haven't registered. We believe this is a good program. It's one of the programs that puts us all in this together. The commercial landlord needs to take a role in ensuring that our businesses stay afloat. The individual business would pay, as well as both the provincial and federal government would be part of that. So we think it's a good program. On top of that, we have an additional rent deferral program in our province that a number of businesses have already taken us up on. And today I announced a business reopening grant, and that $5,000 for an individual business can be used for whatever they choose to use it for as part of the reopening. It could be part rent, or it could be buying supplies, or whatever it is that they believe they require to help them get started.
Olivier, do you have a follow-up?
Sure, thank you. Following Natasha Pay's question on public inquiry, Northwood is not the only example in Canada where there was a lot of cases of COVID-19 in long-term care facilities. So I'm wondering, Premier, if Nova Scotia would be in favor of a national public inquiry on long-term care facilities.
Well, the federal government has acknowledged the issue on long-term care and the role it wanted to play. There's been ongoing conversations. I've been listening to what's happening in Ontario and Quebec today. Again, I want to thank all of those who've been working at Northwood to continue to isolate and control that virus. There's no question, though, there's been a lot of heartache. We know how the virus got in. We know how the virus spread. We now need to look at how do we prevent that into the future. What are the protocols and steps we need to take? But I would certainly welcome a national conversation about healthcare and long-term care. When the funding of healthcare started, it was 50-50 between provinces and between provinces and the federal government and territories. Today, the federal contribution to Nova Scotia is less than 20%, and we would welcome a conversation about long-term care, and particularly around the capital infrastructure investments required to continue to build new modern facilities. But I do want to say, as this conversation continues to go on, I want to continue to voice my support for the men and women who have been working at Northwood, providing the care to their loved ones. And I've been inspired and impressed, quite frankly, by the family members who've had people there who actually succumbed to this virus, the words that they spoke about and how they very much appreciated the care their loved one had received at Northwood. And I want to tell them how much it's been inspiring and really positive for our province to have their voices heard and to have their loved one's story told. Not only their life in Northwood, but quite frankly, their enormous life inside of the building of this great country.
Next question will go to Kyle Shaw with the Coast.
Hi. I think this is for the Premier, but you guys can decide. Now that we're on the brink of reopening, is there any need to extend the state of emergency when it expires this Sunday?
So we're looking at that. There are certain parts that will be required to have the state of emergency continue to be extended beyond Sunday. As you know, there are still you're unable to hold huge gatherings. So there are some legislative requirements for businesses to have annual meetings. Those things have to be done virtually now, so the state of emergency be required to do that. There are some other aspects of daily lives in our province that state of emergency will continue to be required. Well, one of them is, quite frankly, that commercial landlords cannot evict their tenants during this period of time. And as one of your previous questions before you was talking about the lack of take-up when it comes to commercial developers around the rent deferral from the Canadian government and provincial government, our emergency order prevents any evictions at this time.
Kyle, do you have a follow-up?
Yes, I do. This is for Dr. Strang. You recently mentioned that we should bear in mind whether someone is at a higher risk of a severe outcome from COVID before we include them in an immediate family bubble. So do you think that being at higher risk should be taken into account as other parts of society reopen? Like, are there plans to ask higher risk teachers to continue working from home when classrooms reopen, or should higher risk people think twice before going into a busier place like a mall?
So I think there's certainly a number of levels that individuals need to understand what their particular risk of severe disease and severe outcome. But you also have to understand that across all ages, other than very rare, even young healthy adults, there's that in. The older you are, the more number of chronic conditions, that the kind of choices you make and what risk you put yourself at are important. And you know, as various businesses, organizations, correct, you know, and how those play into decisions that we make around, you know, finding that balance between having an opening society and the economy, but at the same time respecting the need to control COVID-19.
Next question will go to Tim Biscay with the Halifax Examiner.
Hi, thank you. Judging by my Twitter feed right now, there's an awful lot of confusion as to the parameters and protocols and how things are going to reopen. So I'm wondering if you can just address some of that. For example, the orders or the press release that I just received doesn't mention kind of public facilities like libraries, theaters, those sort of things. Will there be music allowed at the local tavern? It seems to be that there's a limit of 5 in my house, but I can go meet someone that's not in my family bubble at a restaurant and sit down with them, so long as we're fewer than 5. Will there be more detailed clarification about these sort of issues?
So a lot of that work is working with the various associations, but so we're working with the Restaurant Association about them having up on their website and how they're communicating to the public. You've mentioned restaurants. They're a part of the public health order remains that people need to respect social distancing outside of their household bubble or their household bubble. So actually, if you go to a restaurant with somebody who's not in those not in either your household or household bubble, you actually have to sit down so you're maintaining social distancing. That's not new. That's in the order. So people need to understand what the requirements are, and we have a lot of that information on our coronavirus website. And there, as I said in my remarks, there's a whole new website up and going with lots of information around businesses. But as I said, we continue to work. We will work with all the various businesses, their associations. It's not just government's responsibility to make things clear. We're working with them and ultimately individual businesses to provide clarity to consumers and the public.
Tim, do you have a follow-up?
Yeah, I do. I guess this is the same sort of set of question. It's unclear to me, and maybe you've addressed this, but it seems to have been contradictory a couple of times. Is the goal here eliminating the disease, keeping it to a minimum spread? I guess the context here is the Premier has talked about funding programs to get ready for next year's tourism season, and of course the work is welcome for people who are unemployed. But how do we get to tourism season when there's not a vaccine for the disease, and people, especially in the United States, which is the base of our tourism economy, seem to be going hog wild with it? I guess I'm asking, how does this how do we get to an end of this?
I think, as we've said all along, this is about living with COVID for some time. It's why Dr. Strang has continued to talk about the public health protocols and continuing to follow them. They're pretty straightforward. 6 feet apart, staying within your unit, lots of personal hygiene, washing hands regularly. And as we begin to open up our economy, we have Nova Scotians that have done a tremendous job of working together to continue to flatten the curve and almost keep the virus at bay for a period of time. And what we want to see is there's a second wave, that we don't end up with the entire shutdown of our economy, because we've now done the work to prevent the spread, which means that we can still operate and we don't get the spike that we received in wave 1. And that's the principle behind why we waited, why we've gone slower than some provinces. It's the principle behind why we've worked with associations to be able to go out and communicate a mass message to their members, because everyone needs to continue to recognize that as we open this up, it will be different. Those public health protocols that will be required will need to be followed. And as we look through this year and into next year, I mean, all of us globally want to see a vaccine. If it's not there, we will need to continue to look at parts of our economy around tourism, for example. What are the things that we can do that allows, the family bubble, the self-distancing part to continue to operate? Some tourism operators will continue to do that throughout this year. What we're saying is, though, that in the issue around our public investment was we wanted to make sure on behalf of taxpayers that if we were spending this money, it was going to be spent in assets that, first of all, were for the public good, and second of all, that when that asset is completed, it's something we can build on. It's an attraction. It's that will bring people into a particular part of our province in future years. And quite frankly, it won't just be next, it'll be for decades to come.
Next question will go to Bill Martin with 6 Rivers News.
Thank you so much. Do I understand correctly, Dr. Strang, that a 100-seat restaurant that has the capacity to provide social distancing can in fact accommodate 50 patrons? And if that's true, why would it not also apply to, say, a 100-seat church allowing 50 worshipers?
So again, I come back to that we have to understand it's not just numbers. It's the type of activity that goes on, and the type of potential for close contact. So a whole range of kind of social gatherings are different than the restaurant piece. There's an economic piece around the restaurant as well. We'll get there, but we'll be talking soon about how we open up on the social gathering side of things as well. But it's important that people understand that this is the first step. We have to have continue to go slowly and carefully in this. We've opened up a large part of our society by the announcements today that inherently does inject some increased level of risk of COVID-19. And we continue with our surveillance programs. So we have to take various steps at different times to make sure we're introducing the right level of risk that we're able to manage, and then we monitor that, and if things continue to progress, then we can expand on things like numbers, etc. That facilitate broader ability of whether it's social gatherings or activities that can happen in businesses. We can't do this all at once. It's a careful, thoughtful process.
Bill, do you have a follow-up?
Yes, thank you. Dr. Strang, you were already asked about when you might be able to relax the 5 maximum number. I'd like to take it a different tact and say, what conditions do you want that need to be met to make that allowed?
So it's all based on looking at the epidemiology and then what risk are we able to take on by doing that, and part of that is making sure we have the consultation. One of the previous questions was around museums and libraries. I just yesterday had a conversation with that sector, and we're continuing to have discussions through the Department of Community Cultures and Heritage, with the sport community, with the recreation community, with our kind of cultural community. So there's a lot of ongoing work that we need to get through to, at the end of the day, as we open up these other spaces, perhaps increase the number of people that can be allowed, that the operators of those spaces know how to do that safely.
And that's all the time that we have for questions today.
Thank you, Christine. For all of you out there that are getting ready for reopening, June 5th may seem exciting. For some of you, it may also be a little bit scary. And I don't want you to worry. If you're not ready, you do not have to open on June 5th. Go at your own pace, and safety should be paramount, not only of your employees and you, but also of your customers. I have great faith in Dr. Strang and public health. I have faith in your associations who have brought forward some very solid plans. And I have faith in all of you. Many of you are doing it already, and by all accounts, it is going well. I've noticed some businesses preparing patios with tables 6 feet apart. We are among one of the last provinces to restart, and quite frankly, I'm okay with that, because we have to get it right, and there are no guarantees. But this approach is our best chance. So you still have time to prepare. You should have time and you still have time to ask lots of questions. Don't forget our website, Reopening Nova Scotia. There's lots of information there and numbers that you can call. We will have more to say on Friday about the opening up our economy and social gatherings. And you may feel alone, but you're not. We are all in this together, as we have been from the beginning. Let's not now separate. Let's make sure we stay united on our journey to continuing to rebuild our province.